bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Did you know an estimated 30 million Americans experience lower back pain at any given time? And that can cause another kind of pain, a pain in the neck. Hello again, and thank you for spending some time with us. You're watching Comcast Newsmakers, and I'm Carla Shoal-Lee. Joining me this hour is Dr. Andrew Kirschner. He's a board-certified physician in osteopathic medicine, and today we're going to talk about back pain relief for couples. Dr. Kirschner. Oh, let me turn.
Thank you very much for having me today. I'm great, thank you.
Yeah, you know, I think a lot of it has to do with lifestyle. Would you say for that lower back pain that people experience?
The American lifestyle is really conducive to setting people up for back pain. We sit around too much. Things like the internet, television, long commutes, we're basically sitting down, and we really weren't designed for that.
Okay, so tell us about this hands-on technique that you kind of approach this problem.
Well, I have several ways in which I approach it. In my office, I approach it as a physician with traditional medical modalities and traditional treatments, but I've also developed a program called Back Together, which is a program for couples. A lot of the time we think about an individual in pain, but it's really easy to forget that that individual has other people in their lives.
I never thought of it like that.
The spouse of someone in pain or the loved one of someone in pain experiences the pain in a very different way, but in a real serious way.
Right.
And their relationship can be really easily damaged if people don't pay attention to that.
So, okay, so you bring people into your office, you sit a couple down. What happens after that?
We do a basic evaluation. I want to get a good sense of what the pain is coming from in the first place, so we come up with a medical diagnosis first, but then we'll do an evaluation, and I'll talk to them about their lifestyle, about their activities, the different things that they like to do in and around their home, what sort of work they do. And sometimes we'll even go to their home and we'll do an ergonomic assessment of their home and their workspace. And then we'll go over things that they can do, simple approaches that they can come up with to help reduce the effects of their lifestyle on their pain.
Okay, so how bad is the pain that we're talking about where you can use your technique as opposed to surgery?
Well, people who are candidates for surgery are candidates for surgery. By the time you've gotten to that point, it's pretty serious.
Okay.
And for any program that you're going to do, whether it's with me or with any physician, it's important to really understand what the boundaries and what the capabilities of the people involved are.
And how do we know those boundaries, though?
You got to have a physician that you trust.
Okay. Alrighty. So after you've assessed what the problem is, then what happens?
Well, again, we make lifestyle suggestions. We talk about things that they can do in their home, ergonomic things that they can change. But I also offer them hands-on approaches, which are simple soft tissue techniques that they can do in their own home, on the floor. Real simple things to do that can help them to not just relieve pain, but for the member of the couple who's not in pain, they can actually help to prevent themselves from having problems in the future too.
What are the most common patients that you see? How bad is it for them? What do you see?
Well, that's a complicated question. I mean, people have every kind of back pain that you could imagine. I have patients.
And what is it caused by, though?
Everything.
Oh, really?
I mean, literally everything.
Oh.
I have patients who basically
From sex?
From sex, from everying. Yeah, I've had patients who have thrown their backs out horribly in
really?
active intercourse. So yes.
Okay.
But I have patients who have done base jumping and have hurt their backs that way. I work with professional athletes, who hurt their backs all sorts of ways. And I have patients who have hurt their backs sitting in their car. So I mean, it can really run the spectrum, and everybody can be affected.
And how often is this back pain, after you've treated them and shown them techniques, how often does it come back? And then do you treat it the same way the next time?
Well, it really depends. If they really approach everything in a very complete way, they look at their home and they do all the ergonomic suggestions that I make, they optimize their physique, they'll go to the gym and strengthen their weak areas, and they'll really work on the things that we come up with recommendations for. It's my hope that I'm not going to see them again.
Okay.
It's bad for business,
right.
But it's good for my soul.
Right, I was wondering if you have a repeat client base.
Oh yeah, no, I mean, look, there are certain people who are going to have pain. It's just a fact of life, and if we can do things to help them minimize their pain and minimize the effects of the pain on their life, I'm a happy guy. I feel like I've done my job. But there's still people who, no matter what you do, it's still going to be a part of their life.
All right, Dr. Kirschner, thanks for educating us. Important subject. This hour's newsmaker has been Dr. Andrew Kirschner. He's a board-certified physician in osteopathic medicine. I'm Carla Shoal-Lee. Thanks for watching.